Turn now to today's Health Watch. Summer is almost here, and that means we'll be spending a lot more time outdoors. But as we all know, time in the sun can spell trouble for your skin. In fact, skin cancer is the most common cancer in these United States. Only a small percentage of adults say that they get a regular skin cancer exam. Prevention and early detection can reduce your risk, and that is why the Skin Cancer Foundation has created a program to make screenings more accessible. CBS News Chief Medical Correspondent Dr. Jon LaPook has all the details.
Rainy, dreary spring weather didn't stop New Yorkers from lining up for free skin cancer screenings at this RV mobile site just blocks away from the Empire State Building. 32-year-old Megan Vasquez has never been screened for skin cancer before, but a questionable-looking mole on her leg got her attention.
Have you ever had a problem with your skin?
Vasquez has health insurance, but says skin cancer examinations were never top of mind.
I just noticed that the mole has had a darkened spot within the last year.
Point me in the right direction.
I just haven't been able to have the time. So when I saw that this was going to be here at 8:30 in the morning, I was like, yeah, that's perfect. I'm available at that time.
The screening RV is part of the Skin Cancer Foundation's Destination Healthy Skin program. Launched in 2008, it brings skin cancer screenings directly to communities where access to a dermatologist may be limited. This year, the RV will visit at least 30 U.S. cities in at least 20 states, with volunteer dermatologists offering full-body skin exams and education about skin safety.
Our program here is all about saving lives and finding cancer early.
Dr. Deborah Sarnoff is president of the Skin Cancer Foundation.
Some people have insurance, but they can't afford the deductible, the copay, the coinsurance, and other people do not have insurance. And so this is a way to get a free skin exam, costing nothing, and to get educated about the signs, what to look for early detection.
You know, Dr. Sarnoff mentioned the importance of early detection, and people should know about the A, B, C, D, E's of melanoma detection.
Okay.
So A is a mole. If you find a mole, is it asymmetrical? B, are the borders irregular? C, is the color weird, funky, different types of colors? It could be very dark, it even could be pale. D, is it greater than the diameter of an eraser? And E, is it evolving? My patients have trouble remembering all those. So Dr. Francesca Fusco, who's my dermatologist, taught me something called the ugly duckling sign. So we all have ducklings. I have a little duckling there, the duckling there, little moles.
Those
right
are cute
there.
ducklings.
If there's an ugly duckling, there's a duckling that doesn't look like the other ducklings. That could be a sign that maybe you should check it out with your dermatologist.
I do have a little something, a spot that has, you probably can't see it under the makeup, but it's grown over the years. I finally realized, so I have to go get it checked out.
It's E, it's evolving.
That's the E. I need to find that van. Mm-hmm. So skin cancer in general is less common among Black people, but late-stage melanoma is not.
Yeah, so you know, you have the melanin in your skin that helps protect you from the ultraviolet rays.
But not completely, right? Like Black people still need to wear sunscreen.
You still need to wear sunscreen, and also it can be very tough, especially if you're not specifically trained, to pick it up. You know, it's like you're looking at maybe a darker spot that's on a darker skin and may be tougher to see. Also, people who are Black may tend to get the moles on the palms of their on their palms, on the soles of their feet, or even under their fingernails. So, you know, I'm at NYU Langone, you know, that's where I'm a professor of medicine. We actually have a special person and people who are specifically trained in this, in detecting melanoma and other lesions in people who.
So I'll be emailing you after this to
Yes.
see if maybe you can hook a sister up, because those appointments are hard to get.
I can write off the whole morning if I'm giving you medical advice.
I don't know about that, Dr. LaPook.
So there are benefits short of preventing cancer to taking steps with sunscreen, right? I mean, like this face is 44, but right here, 65. The leather neck is real. I mean, how big are the benefits of anti-aging?
You know, well, so, you know, we looked about Gen Z. You know, they're very into skincare, but they know very little about the risks of skin cancer. So it's a weird thing going together. Huh. You know, SPF 15 or above is very protective. You can wear clothes that help block the rays, a hat, all that stuff. I remember when I was a kid, you know, which was when dinosaurs roamed the earth, you know, people would be taking the reflectors and they would have the baby oil and the stuff. And I remember a couple of times when I would have peeling, you know, you'd have a peeling sunburn. So if you've had a couple of peeling sunburns, bad sunburns as a kid, it can double or even more than that increase the risk of melanoma. So I think people need to do self-exam. They need to, your internist, your general doctor should be looking at you. And also, I think that a dermatologist should be in your life.
All right. I look forward to it. Dr. LaPook, thank you so much.